Frontline workers, that's the medics. Some of them are claiming that about 20 of them have been infected. That's according to KMPDU. The government, on the other hand, is rubbishing those numbers. COVID-19 pandemic has not spared the country's frontline, with Doctors Union now saying up to 20 of the health workers have been tested positive and 10 are in quarantine. The government, however, discounted those numbers without giving specific figures. MoH has more.
They are Kenya's most valuable resource during the coronavirus outbreak. But as they battle the pandemic on the front line, health workers face a dire risk of contracting the virus that has killed tens of thousands globally.
Because of the nature of their job, will get exposed, and in some cases will even get infection.
The Kenya Medical Practitioners and Dentists Union is alleging that already 4 doctors, 6 nurses and 10 clinicians have so far tested positive to the virus that is spreading like bushfire. The union officials also say more 80 healthcare workers are in quarantine after coming into contact with COVID-19 patients without prior knowledge or proper protection.
When workers go on quarantine, when frontline workers, we have a depleted number of staff to continue responding to the pandemic.
But the Ministry of Health is disputing claims made by KMPDU.
It's like a prayer that we get more nurses sick, and we get more Kenyans sick, and we get more doctors sick. Thank God that it is not the case.
But the Doctors Union has stood by its allegations. They say a good fraction was as a result of exposure occasioned by lack of proper protection.
Hawana hata hii ama hata hiyo face shield, kwa sababu ugonjwa unaenea kupitia macho, pua na mdomo. Ndio maana kwanza tunaanza kufunika hapa, alafu na huku kwingine ili kukiwa na chochote ambacho kimekufikia iwe hakijashika zile nguo zako za kazi.
After Kenya registered its first case last month, healthcare workers across the country put out an urgent call for medical supplies, specifically surgical masks, goggles, and gowns. But if KMPDU numbers is anything to go by, then much is yet to happen in terms of equipping Kenyan soldiers against the pandemic. Mwachonda is warning that if hospital workers are not equipped with resources and protection they and their clients deserve, the country could be staring at a depleted army, which could translate to long shifts for the frontline people.
And when they get this infection of COVID-19, as they continue to see more patients, they'll keep on infecting the patients whom they are seeing on a daily routine who have different diseases.
It would be a matter of utmost irresponsibility for a county to send its frontline health workers without adequately protecting them from possible infection.
The Council of Governors Chairman Wycliffe Oparanya acknowledges that the supply of PPEs has not been sufficient, but promises that the tide could soon change.
Although what we have been provided has not been enough, I have now been told that more have arrived overseas, and I hope by next week the issue of PPE will be an issue of the past.
MoH, Citizen TV.